Hey, this is Doug Field, along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. You know, we're excited to have our current guest on the phone. He actually represents an employer coalition up in the Mid-Atlantic Business Group on Health, and he's also a member of the National Business Coalition, and joining us to talk with us about what they're doing around, enabling employers to better assess PBM carve-outs and part of PBM plans is John Miller, the Executive Director. John, good morning.
Hi, thanks, Seth. Thanks for having me. Glad to be here.
Yeah, good to have you on. Tell our audience a little bit about what you're doing with, the tool that the National Business Coalition on Health has recently launched.
Well, we've derived this tool from a previously existing instrument that was called Evaluate that we were using to evaluate the performance of integrated medical plans, which also include PBMs. And it occurred to us that this was an opportunity for us to pull out this already vetted and evidence-based set of questions having to do with PBMs and open that part of the assessment up to freestanding PBMs as well. So employers could compare carve-in, as in part of an integrated medical plan, PBMs to carve-out, standalone PBMs, large PBMs to small ones, so on and so forth in terms of the service, of the quality of service they offer. And that's the background. So we pulled it out and we've launched it. And for the first year, we have 4 PBMs participating. This will give us a very good cross-section and a place to start and learn as we improve the tool.
Very important area. Ron and I talk a lot on this program, and we talk at the Institute about, there's not any piece of this changing healthcare environment that can go unreviewed and looked at. And certainly PBM is one of those areas.
Totally agree.
Does this include specialty health?
As a subgroup, but it is not. It's not designed for specialty drug PBMs. If that's what you mean, it's more.
Yeah, I did.
It's intended for comprehensive PBMs, not such as Diplomat or others that would be specialized in specialty medications.
Okay.
John, it's Ron Bachman here. The whole PBM area for many people for a long time has been very confusing. So I think you really tapped into a market need out there to create more information, more understanding in this area. The pharmaceutical benefit manager, the PBM out there, has been sort of an area that there hasn't been much transparency in. People really don't know what medications cost. There's all sorts of discounts and terminology that's not natural or normal part of the language for the consumers, AWPs and so where's that going in the marketplace? Is what you're doing starting to sort of draw back that curtain so that there's much more understanding on choices and options and how to do this, but also where we stand on pricing for all this that people in the past have been very confused about?
We actually don't spend very much time on the pricing element, I'm sorry to say, although we certainly could. Even though your observation is right on target, and I totally agree. As we tried to look at pricing, what we found was that the prices that were offered are so dependent on the demographics of the employer, the size of the employer, and how many lives they have, what kind of a bargain they can drive. It was much more negotiated, rate driven. So we don't spend a lot of time on that, although we do ask some questions about rebate policies, whether those rebates are passed through, how transparent that process is, but not so much time on that as we spent time on the quality of the services that are offered, which on that side, Ron, there's even less information than there is on the pricing side. So usually our observation was that consultants and brokers that are conducting these RFPs on behalf of the employers are usually looking at really basic things like administrative capabilities. Are you getting new ID cards out to members accurately? Are you answering the phone promptly? And then they also, of course, focused a lot on geo-access, making sure there was a pharmacy in the proximity of all of the employees and plan members. Mm-hmm. So that seemed to be the place where that was their idea of quality, and we think that the quality of what the PBM offers should go way beyond that. So what we're measuring is more things like, you say that you help members adhere to their medications. How do you do that? What sorts of processes do you have in place, and how effective are those processes? Are you providing tools for the folks, the consumer that you're referring to? Are you providing tools for them to be able to know how to buy the least expensive, effective drug? We also ask them a lot about providing reports to employers, because they all say that they do that, but there's huge variability in there. So are you providing usable reports to an employer so that they can use that information to manage their overall cost spend? Mm-hmm. I think one of the reasons that we also got into this was we heard from employers that they were beginning to recognize the potential for conflict of interest, both from in-house PBM collaboratives that are sponsored by the larger consulting houses, or from broker fees that might influence the smaller brokers toward one PBM or the other. Not necessarily that large PBM collaborative being sponsored by a consulting house was not good quality, or that the broker was not necessarily directing the employee, steering the employer to a high-quality PBM in terms of the services offered. But if nothing else, they could look at this third-party assessment and say, okay, I've done my due diligence, and I now know that this actually is the best value for me in terms of a PBM. Mm-hmm. I haven't just been steered there by a large consultant or a broker who has some kind of a financial gain behind the scenes that I'm not aware of. Long answer to a short question, but we don't spend a lot of time on pricing. We spend more time on the quality of services.
Hey, John, what's the target size employer for this tool?
It would need to be a self-insured employer, therefore anywhere from 250 employees on up. However, my guess is that you get someplace beyond 25 or 30,000 employees, you probably have the capability to do these kinds of things yourself. Although it really extends all the way up, because as I described, even the large employers, and we've interviewed a few of them in this process, even the large employers, their consulting houses are not asking these kinds of questions. They're still focusing on geo-access, are the ID cards going out accurately, that kind of administrative stuff.
John, and what's the cost to me, an employer?
If you're a member of a business coalition, it will vary by the business coalition.
Okay.
27 coalitions like mine are sponsoring this tool, but usually I think it's probably a part of membership.
Okay.
You know, of all the different things that you mentioned, you're really in an important place here in the whole scheme of things, John, to try to deal with this issue, which is, in many cases 25% of the total health care bill anyway. But from the consumer side, that very end user, one of the areas that you mentioned that really strikes with me is the issue of compliance. How is the PBM assuring that the patient is getting the right medication, that they understand what they're taking, and that they're compliant in taking that medication? Did I hear that right? And if that's correct, or even if it's not exactly, explain what you might mean by value-based purchasing. Is that more from the employer side, or is that also how the consumer, at the end of the day, helps to select the medication with his doctors?
It drives all the way through. From my touch point is the employer benefits person that's making the PBM decision on behalf of, whether they know it or not, on behalf of the 20,000 or 500 employees that work for that company. But that benefits purchaser also wants the member to be able to make a value-based decision. Wants the member to be able to calculate, how much is this drug going to cost me when I show up at the counter, or when the bill arrives, if it's a mail order sort of a pharmacy situation? Is it worth it to me as a consumer to buy a brand name drug, for example, because I feel so much better about it than a generic which might cost 20% as much? Is it worth it to me? And if it is, so be it. But I, as a consumer, should also have that information, and we do ask the PBMs as a part of this tool, what kinds of assistance do you give the end user consumer in making an intelligent decision like the one I just described about which drug they're going to opt for if there's a choice between drugs?
John, we really appreciate having you on this program. We've got about a minute to go, and I want to allow you to kind of leave our audience with some key takeaways.
Well, I appreciate that. Thanks. I guess the most basic one would be to say that although they may appear to be the same, PBMs, large ones, small ones, carve-in ones that are part of the overall medical plans, carve-out ones, are not a commodity. They are different. And a tool like this can help you objectively compare each to the other in terms of quality, the kinds of quality that I've been describing. I also would say that if one can drive the PBMs to improve the sorts of processes that I've been describing, that can lower overall costs. If we can improve compliance and adherence, we're going to lower emergency room visits, amputations, other much more costly down the road costs. And I would also say that employers have been irresponsible in the past in not wanting and demanding this kind of information so that they can drive improvement, which will improve their costs, and in the long run also improve the services that employees and consumers receive as a result of all that. That's my overall message.
John, I appreciate it. And they can find information on this tool at your website. Would you mind giving it?
They can. www.evaluate.org is the best place, or NBCH for the National Business Coalition on Health.org.
John, listen, thank you so much. I hope you can join us at our forum coming up May 7th to 9th. I think you'd find the audience very receptive to some of the things that you're doing. And go ahead. I'm
going to try. I'm looking forward to it. Thanks for the invitation.
You bet. Have a great weekend. And to the rest of our audience, enjoy your weekend. And we'll see you next Friday on Healthcare Consumerism Radio.